Hey everybody, this is Coach Bronson from CrossFit PCR. How many of you sit in your chairs like this? Right? It's very comfortable. I know I'm guilty of sitting like this many times, whether I'm in a meeting at work or just hanging out with friends or sitting on the couch. This is probably the default position that most of us sit in. Right? Maybe not your legs crossed, but that slouched butt forward on the chair, leaning back into the seat, rounding in the lower back. Okay? You sit in this position for a while. When you stand up, what's the first thing you do? You kind of arch your back a little bit, get that little stretch, right? Before you can move because you've been in that bad position for such a long time. Okay? If I get into the proper position, what's that look like? Right? That looks like something we've talked about before, the hip hinge. My hips are where my body is bending, not my lower back. Okay? In order to maintain this position, what do I have to do? I have to use my back muscles. I have to sit in proper posture, which takes a little bit of work. That's why we don't do it a lot of times. Okay? This is a lot easier because I'm not using as much musculature, right? I'm not using the muscles in my back to support myself. I'm just using the weight of my body, leaning into that chair just to stay up. And I'm not really up, I'm leaning back. Okay? Pushing back, sitting tall, rolling my hips forward takes work. That's why we don't do it. Okay? We are inherently lazy. That's the problem. People have back pain because usually we just don't do what we need to do to avoid back pain. All right? So how do we fix that? One, every time you sit down, try and sit with proper posture. That's the first thing you can do, is in your everyday life, do the things that you need to do to maintain proper posture and keep yourself from hurting yourself. Okay? The second thing we can do, we have two movements we're going to go over today. And one is called the Good Morning. The other one is called a Superman. Okay, both of these are designed to help you, one, learn how to move your hips properly, and two, develop the strength in your back to maintain your positions that you need to keep your back from hurting. Or if your back is already hurting, to help the pain go away and develop the strength to keep your positions proper. Okay, so what is a good morning? A good morning is where you're going to keep your feet right under your hips. All right? And then you're going to send your hips back a little bit, keeping your back flat, right? You're going to lean over with a slight bend in your knees until you feel a little bit of pressure and pull in your hamstrings and your butt. All right? When I get to this position, notice my back is still straight. Okay? I'm now using my back muscles to maintain this position. You're going to feel some tension back here, and it may be hard to do this. You may instantly want to go down. You may instantly want to lose that tension in your back. Okay, don't. Keep it tight. If you can only go this far before you start bending at your back, notice I'm bending at my back now, my hip's not moving, then just go to this far until you can get a little bit further, until you learn how to hinge at your hips. Eventually, you should be able to get down to the point where you're almost parallel with the floor, and then you can stand back up again, okay? If you can only do this for now, that's fine. Just do that. All right? The idea is that you learn how to hinge at your hips, and keeping that position with your back helps you develop strength in your lower back to get rid of that pain and prevent pain from happening again. You can do this, right? You can do this at home. If you want to add a little bit of weight as you get stronger and you get better at hinging at your hip, you can add some weight. Right? Same thing. Just hold on to the weight, keep it close to your body. Bend over. If you have bands at home, this is something you can do at home. I want you guys to do this at home as much as possible. Right? Come into the gym early and do it. Do it a few times a week. Don't just do it once and say, hey, I did that, I should be good now. It's something you have to maintain and keep working on. Okay? With the band, the more band you grab, the harder it will be. Okay? If you use a band, it's a good thing you can do because you can practice that hip movement. Push your hips into the band. Push your hips away from the band. Slightly bend your knees. Okay? So that is the good morning. Something you should do maybe 15, 20, 30 reps a day, a couple times a week. It will help strengthen your lower back and prevent and fix lower back pain. Another movement you can do, we call the Superman. Okay, you're going to lay down on the floor in your stomach. Okay, you're going to put your feet together, your legs together, behind you, hands out in front. Okay, thumbs in the air. You're going to lift your legs and your thighs off of the ground. All right, and then you're going to lift your arms and your back. 1, down, 1, down, down, okay? It's pretty simple movement, but it's not very easy. Okay, the hardest part about that is keeping your legs straight, not bending your knees, and getting your thighs off the ground. That's squeezing your butt and pulling with your back. Okay, that's definitely something you're going to feel in your lower back. If you've never done them before, don't overdo it. Maybe 5 to 10 to start, and then as you build up, you can get into the 15s and 20s, okay? All right, those are your 2 movements for the week, the Good Morning and the Superman. Hopefully they help if you do them with fixing or preventing lower back pain. We will talk to you soon.